Hello, Dr. Wandler, coming to you again from Wandler Chiropractic Clinic. It is May 7th, and just wanted to relay a few things. First of all, we are back in business. Back in business. We started working again on patients that are non-emergency, if you will, yesterday, May 6th, and we just wanted to make that announcement. We are so happy to be back. Unfortunately, our massage therapists are not back with us yet. They are still waiting for phase two to occur according to the Alberta government. So they are not with us, but we do at the end of this, we have a link with one of our massage therapists, Denise, who hope you enjoy just a short little clip about what she's been doing. But we wanted to let you know that we are back. We are seeing patients. We are so happy to be back. I can't believe how much I've missed all of you, and I'm really looking forward to finding out how you made out over the COVID break, and then helping you with your health, and looking forward to just catching up with you. There are going to be some changes, as you can be aware. The Alberta government and allowing us to open and puts certain protocols on us, as outlined by our provincial college. So I just want to let you know that there are going to be some changes. We are staggering appointments. So we are not able to see as many treatments and not as many patients during the day, because we're trying to get as patients in on their with themselves, just solo, when they do come in. So there's no overlap with patients. We're trying to avoid that as much as possible. If it happens to be that some patients do come in, at the same time, one's a little early, one's a little late, we are practicing physical distancing. There's never any problem that way. We want to let you know that we are sanitizing everything before and after, of course, and we want to also let you know that we are providing hand sanitizer. We are asking patients to hand sanitize their hands on the way in and on the way out of the clinic, just to again further help that situation and keep things safe that way. Staff with patient contact will now be required to wear our masks. There's one right there, and we will be wearing those. Patients are not required to wear a mask. However, if you feel more comfortable wearing a mask when you come in, by all means, please do. There's going to be also questions. We're going to be pre-screening your questions when you phone in to make your appointments. I'm just going to go over what those questions are here right away as another level of being aware of those questions. You will also be signing a questionnaire with those same questions when you come in, and that will document that you, as far as we know, are safe and not infected with COVID. And we're also asking that if you have any of the symptoms that I'm about to outline, that you don't come into our clinic until you are symptom-free and have completed the required isolation. So here we go. This is what we're going to be asking you as far as the pre-screening questions goes. Do you have any of the following symptoms: fever, or feel fever-ish? Do you have a new or existing cough? Do you have sore throat that's not related to a pre-existing condition? Runny nose not related to a pre-existing condition? Nasal congestion not related to a pre-existing condition? Or difficulty breathing not related to a pre-existing condition? Have you traveled internationally within the last 14 days? That means outside of Canada. I don't think there's many that have. Have you had close contact with a confirmed or probable COVID-19 case? And have you had close contact with a person with acute respiratory illness who has been outside Canada in the last 14 days? If you answer no to those questions, we're gonna love having you back in and getting you treated. So I have a couple of links, as I said. We're going to be one interview is a talk, just a quick interview with Denise England, one of our massage therapists. I want to invite you to check that out. We also have a bit of a link to, I'm not going to divulge too much, but it's 3 minutes of what I feel is probably one of the best sounds in the world. And if you don't smile when you're watching this, I don't know what's wrong with you. And anyway, I want to also then bring to your attention, of course, special days. May 7th, this is the National Day of Prayer, which, boy, we can all use some of that right now. And this is also, believe it or not, the National Leg of Lamb Day. So if you were wondering what to have for supper tonight, and that appeals to you, this is National Leg of Lamb Day. Also, some important weeks. May 3rd to 9th, is National Raisin Week. Again, do with that what you may. And two that I want to acknowledge, because we have a number of patients in here that we treat that are important parts of these particular groups. May 3rd to 9th is National Correctional Officers Week. And as I said, we have a number of patients in here that are corrections officers. Really, really appreciate the work that you do. Sometimes it's very, very difficult work, and we really appreciate that. And especially this next group in light of the whole pandemic that's going on, and talk about frontline healthcare workers. This May 6th to 12th is National Nurses Week, and we really appreciate all of our frontline workers, and in particular nurses, who have given so much and sacrificed so much to keep us safe and healthy. I hope you've enjoyed this video. I've enjoyed bringing them to you. And I just, was, again, so thrilled that we're able to be back in our clinic treating our patients. Looking forward to seeing all of you in the near future. Take care and check out those links. Bye-bye.